Morning. I'm Jim Moore with O'Donnell and Associates, a New York State government relations firm. I'd like to thank all of you for joining us today for an important conversation on at-home drug deactivation and next steps in the fight to end the opioid epidemic in New York State. Shortly, we will hear from stakeholders from the national to local level that have been active in the fight against the opioid epidemic, including General Barrye Price, who is president of the Community Anti-Drug Coalitions of America, Dr. Chinazo Cunningham, who is commissioner of the Office of Addiction Services and Supports, Assemblymember Sarah Clark, Assemblymember Phil Steck, chair of the Assembly Committee on Alcoholism and Substance Abuse, Senator Pete Harcum, chair of the Senate Committee on Alcoholism and Substance Abuse, and Albany County Executive Dan McCoy. Without further ado, I'd like to introduce my colleague, Jack O'Donnell, to talk a little bit more about General Price and the work that CADCA is doing.
Good morning. Thank you to the panel, and thanks so much for everybody for joining us. It's my distinct honor to introduce General Barrye L. Price. General Price is a scholar. He's got several degrees, including a PhD in history from Texas A&M. He's a soldier who served 31 years in the United States Army, rising to be Deputy Chief of Staff of Army Forces at Fort Bragg. He's served on presidential commissions. He's written books. His awards are too many to list, but I will mention he's received the Distinguished Services Medal and 3 Legions of Merit. He's now the president and CEO of the Community Anti-Drug Coalitions of America. It's a group of community groups that has members in every state and in 30 other countries that harvest the power of community to prevent substance misuse. We're really honored to have him with us, and I'm really looking forward to hear what he has to say. With that, I'd like to introduce General Barrye L. Price.
Thank you, Jack. Alyssa, can you roll the video, please?
So this is the ship they say is unsinkable.
It is unsinkable. God himself could not sink this ship.
Iceberg, right ahead!
From this moment, no matter what we do, Titanic will founder. But this ship can't sink.
She's made of iron, sir. I assure you, she can. And she will. It is a mathematical certainty.
Senator Harcum, Dr. Cunningham, elected officials, distinguished guests, and residents of New York, thank you for this invitation to participate in this very important discussion. The clip is, of course, from the movie Titanic, and the segment is called A Failure of Imagination. Just as all passengers on that ill-fated voyage bought into the hyperbole that Titanic, a ship made of iron and steel, could not be sank, there are those who still believe that opioids, even when taken as prescribed, can't be addictive. We know that that's not true. New York, with your proposed legislation for safe disposal, you aren't just imagining what can be, but you will quickly become the example of what right looks like within our nation. Let's build the slides, please. So if we look at if you've ever seen an iceberg from a ship, it's perhaps one of the most impressive phenomena of nature that's imaginable. It is the most beautiful and elegant sight as it sits tranquil in the water. But what's under the surface is usually what's the problem. And hence this focuses on what's below the surfaces for us right now. In the current state, we've heard that there's 108 overdose deaths in our nation from November of 2020 to November of 2021. 74% of them are due to opioids and fentanyl. That's 295 deaths, overdose deaths every day. 108,000 people. That would be the 6th largest city in the state of New York. that eclipses Albany by 14,000 people. Imagine that everybody in the city of Albany died last year, plus another 14,000 people. What we know about our nation is that the U.S. represents 4.4% of the world, yet we consume 80% of all opioids in the world. 4.4% of the world consumes 80% of all opioids, which suggests that we may be a little pain averse. So there are upstream solutions that are available. One is primary education, education and primary prevention, which my company, CADCA, does, where we seek to solve the problem before it ever starts with upstream solutions. I would tell you that safe disposal with the Deterra drug deactivation kit is essential. We know that 64.6% of people abusing opioids never had a prescription. 64.6% of the people never had a prescription. What that tells me is that we have a problem with circulation. That is taking pills out of circulation. And we've had a failure of imagination in that, in taking pills out of circulation. This Deterra pouch really provides a great solution. People we know from NIDA that are from the FDA that people use only about 25% of the meds that they're prescribed. That means 75% of those medicines aren't used. And what do we do with them? Think about your own experiences. We save them. You know, why? Because there may be a reoccurrence of whatever the malady that we had was. Or what if this, there's a resurgence of what I needed the opioids for? What if I need them again? You know, we think about how onerous a process it was to get a doctor's appointment and to get a prescription. And that shapes our decision to save them. You know, medicines like milk have a shelf life, you know, and when they expire, they expire. And the whole notion with opioids is that you take them, you know, up until you've remedied or you've controlled your pain. And then the notion is that you should then go to switch to non-opioid options, because we know that 3 days of opioids as taken as prescribed, you can begin the process of addiction. After 5 days, usually we believe that you have all the properties of addiction. Likewise, this Deterra pouch makes all the drugs inert and irretrievable. That is, all drugs, even those drugs laced with fentanyl, it deactivates those drugs. We are advocating for other evidence-based solutions like medicated-assisted treatment, screening, brief intervention, and referral to treatment. And we're doing DEA 360s all over the world, all over the country, in most of our hardest hit cities. Operation Engage, where we are educating on the opioid crisis, and we're also giving out Deterra pouches. One thing I'd like to share this last part with you, that the last stand is still here. That's the accounting principle, that meth, LSD, crack, heroin, cocaine, those have never left. They are still present in our communities. 95,000 people are dying from opioids annually, and 400 from alcohol annually, and 480,000 are dying from tobacco annually. Let's go to the next slide, Alyssa. And I will just give you a personal testimony of how Deterra changed my circumstance. You know, when in 2016, when I arrived at CADCA, I was riding, I had in my personal possession a small pharmacy. My wife's a psychiatrist, a medical doctor, and I had all of these pills that my doctor gave me to take to Iraq with me 2010. He gave me a year supply for anything that may have happened to me or I may have been exposed to in Iraq. I came back from Iraq having taken 0 of those pills, and I had a problem. And I said to my wife, hey, I'm going to throw these out. No, you can't do that. You can't put them into the trash. Oh, I'm going to flush them down the toilet. No, you can't do that. Oh, I'm going to mix them with coffee grinds, as the CDC, as the FDA had on their website. No, you can't do that. That doesn't really work. And anybody who has a problem will go through anything to retrieve those pills. And so I decided that, and I met Barrye, the CEO of Barrye, at one of our mid-year events in Las Vegas. And I told him about the problem. He told me about his product. I said, man, I got a life of a small pharmacy of pills that I need to deactivate. And he sent me some pouches, and I deactivated all of those pills. Likewise, my brother died in 2020, June of last year, of significant malady, COPD. He was on kidney dialysis. He was taking blood thinners, and he had over 2,000 pills in his apartment, you know, that I needed to deactivate. And I called Barrye and got some industrial size containers to deactivate all of those pills. You know, in the future, Barrye is truly the solution for deactivating, because again, the notion is irretrievable and inert. Make the pills inert and make the pills irretrievable. Slide off, Alyssa. New York, you're on the precipice of making impactful change, a change that will equip each New Yorker with the ability to play their part in our national solution. The doTERRA drug deactivation system should not only be co-dispensed with opioids, but it should also be co-dispensed with benzodiazepines, with stimulants and hypnotics, all controlled substances, as it deactivates all of them, and they all play a role in the drug overdose death rates. Likewise, you should set up kiosks in high-touch areas in schools, and you can have and take your own, make your own take-back days within the state of New York, with using doTERRA as a solution for getting rid of those pills. I will also tell you that CADCA has 341 coalitions in the state of New York. 68 of them are members of CADCA. So we can help assist you with distribution outside of pharmacies within the state of New York. We have tremendous experience where we've distributed more than 3 million bags, pouches nationally through our coalition network. Finally, you should learn also from what others have done. And I would ask you all to take a look at Summit County, Ohio, and they have a remarkable doTERRA project on their website that'll tell you how they used doTERRA and how they were able to change circumstances significantly in their town. And I'll stop there.
All right. So as we transition to the panel here, you know, I again would like to thank everyone for joining us, and General Price, thank you for the powerful remarks there. You know, and I think everyone on the forum here shares the dedication to disposal along with treatment. I'd open by posing to the entire panel, you know, why is disposal important, and why is it an important complement to effective treatment routines? You know, and I'd open that to anyone to jump in on.
I think proper disposal is so important, especially when you're always worried about the environment. People don't realize when you flush it down the toilet or put it down your sink, it not only gets into our sewer system, gets into our streams, contaminates so much of the earth that we don't even realize. And a product like this and products that are out there will really help change the environment. But as the general said most elegantly, get them out of the house, get them disposed of in a safe manner.
And I would also add, just as a mom of 3, 2 teenagers and a preteen daughter, that what we have in our medicine cabinet, we hold oftentimes because we think we might need it at a later date. And we just have to change that behavior of adults, because kids are very much curious and also talk to their own friends and all have access to the internet and social media and know what drugs are right away, and will use them if I think available. I think the idea of having multiple ways of disposing is so good, because you never know what's going to work for one family, whether it is at home and making that easier, or these safe disposal sites around your area or your community, or the take back days that they do have that are very public. So having all these different options is really the key, because you never know which is going to sit right with one family. But getting more and more people in the habit of it is what we need to do to get the drugs out of the hands of anyone who may be just taking them from your medicine cabinet without you even knowing.
Dr. Cunningham, to the end of the tools in the tool belt concept that Assemblymember Clark was talking about, what are some of the gaps that you're seeing in the state's current disposal and patient education framework? And what are some of the tactics that OASIS is looking at to remedy that?
Yeah, thank you. I mean, I think that some of the issues we have really are about equity, in fact. And so the take back, days are important, but as we know, they're not available in every community, and particularly in rural communities. And we also know that, they're associated with sheriff's office, and a lot of people may not feel comfortable or maybe, hesitant to sort of engage with sheriff offices. So, this is yet another way using doTERRA bags, deactivation bags that really go to where people are. It's a harm reduction technique. It's meeting people where they are. It's being able to, address people who can't get to other places or who won't for whatever reasons. And so, I think, as Assemblymember Clark mentioned, we need a host of ways to really address this in a comprehensively. And so this is one key tool among others. And having a menu then allows people to sort of choose the option that works best for them.
That's great. That's great. And I'll kick it back to County Executive McCoy. So locally, I know Albany County has done a lot of work around disposal. Can you talk a little bit about the specifics you've done locally to complement, the statewide Take Back Act and things like that?
Absolutely, and I do want to thank Senator Kennedy, Assemblywoman Gunther for the bills they both respectively sponsored for disposal of drugs. But back in August, I used my emergency power to basically make it for pharmacies have to provide opiate disposable and deactivation pouches for every prescription that's filled. I did it with my counterpart, Steve McLaughlin, over in Rensselaer County. But we want, with the settlement money coming in from the opiate settlement, I want to say I'm very proud that Albany County was one of the first counties, not just in the state, but in the nation, to sue on a national level. But as that money's coming in now, we have to use it smartly, and we have to use it differently, and not put the burden on pharmacy or people getting it, and people getting prescription drugs over the internet now, because everyone knows that they call you constantly to switch your drugs over. To really educate people too, it has to be about education, and it has to be about proper disposal. But that's what we did back in August, and a variety of other things my office was working on. We did a mobile response for the opiate epidemic that was going on in our county, because from 2019 to 2021, we went up 77% higher in opiate overdoses than we've seen before. In general, you did scare me when you were talking about the population in the city of Albany, which I represent in the county. But to put it in another point of view too, in all the wars this country has fought in every war since the beginning of time, we've lost 1.3 million soldiers defending this country. 1.3. Well, in the last 20 years, from 1999 to 2020, we lost over 1 million people to overdoses. Think about that staggering number, and consider less than 1% wear the military uniform, and we have a population of 330 million Americans, a little over 331 to be exact. But we have to think outside the box, and that's why we did this response team to really educate people, like, hey, this is where you can put your loved one. This is where you can get help. here's ways of disposing things. And I want to go back to, I think it was the Assemblywoman, forgive me, who said got small children. I joked around. I said, as my kids got older, I could tell you how many beers were missing. I could tell you if the liquor was a little empty, but no one looks at the prescription drugs that are laying around in their cabinets. And when I talked to realtors from across the county in the capital region, they were having issues with people looking at homes, especially with the high market, not going in there to buy, but to really steal the prescription drugs that are in the medicine cabinets that are left behind. And that's when we said, we have to do something differently. We have to try it. So we started to get this initiative out there, and really just not in the state of New York, but across the nation, to say we have to get rid of these and educate these parents to get rid of these prescription drugs.
Thanks, County Executive. So to the end of, I think the ongoing theme here is having multiple tools in the tool belt to, take a multi-layered approach to the epidemic. To that end, Senator Harckham and Assemblymember Stack, I think there is some overlap with, your committee's oversight as far as treatment. And I know Senator Harckham, you recently had a bill passed that opioid antagonists and education be provided with opioid-related discharges. Can you both talk about a little bit about the bigger picture and how you see sort of the next steps playing out, between disposal and treatment in the state over the next couple of years?
Sure, it's a great question, and as the commissioner and the general said, it's a multi-pronged strategy. It's harm reduction, it's treatment, it's prevention, and it's recovery. So, on the harm reduction side, we're also looking at getting naloxone out there so that people are prepared to reverse an overdose should that happen. Fentanyl strips, because we know fentanyl is in everything. Breaking down barriers to treatment, both from an equity perspective, from an insurance perspective, making medication-assisted treatment more universally available in emergency rooms and other facilities. So, the system continually evolves, and every year we kind of plug holes in it. And disposal is an important piece of the harm reduction side. I would just say, getting back to that discussion you just had, a lot of people in my district don't know about disposal. We do a lot of drug buybacks with local law enforcement, and we hand out pouches when folks give us, and they've never heard of them. So I think we as a state and as legislators and as policymakers need to do a better job of educating the public as to the benefits of deactivation pouches and how we can make them more readily available, along with all of the other tools that we're working on collaboratively.
So, Member Stack, I think you're muted.
Unmute. So I would just concur on this issue and what everyone else has said. In my committee, I would say we focused on three things. One is the problem of so-called sober homes or recovery residences, and trying to make sure that those are actually supportive places for people who are in recovery. We have focused on a program called New York Matters, which provides aid to first responders who are dealing with people in the midst of drug or mental health crises, and also providing telehealth on the scene when necessary to assist first responders. And the third thing we've been trying to focus on is providing mental health services to people who have co-occurring drug problems and mental health issues. I would say that, as I've said to the Democratic Conference, 2 out of 3 ain't bad. We've had success. On the first 2, we have not had success. On the third, there's just a lot of institutional resistance. The programs are few and far between for dealing with co-occurring disorders, but this takes persistence. But I would say at this point in time, the problem of co-occurring mental health and drug dependency disorders is more of our key focus than disposal, for example, but we certainly support all the efforts that have been referred to here.
Yeah, thanks, Assemblymember Sec. So this next question is for General Price. You talked a lot in your introduction about how at-home deactivation has grown nationally. Can you talk more about specific success stories and a little bit about how it's fit into the bigger picture in those areas?
Sure. I referenced the Summit County study that they did where they had drug deactivation. They were co-dispensing. They had them at high-touch areas, at pharmacies. They had them in fire stations and police stations. They had them in schools. And they can show economically, the economic savings by virtue of deactivating those drugs, taking those drugs out of circulation. We've worked with a pharma initiative called Rally, the RX abuse RX abuse. I forget what the rest of it stands for right now. But what we've done is we were in 16 states and 24 cities where we have gone and spoke on the virtues of Deterra and in-home safe disposal in getting drugs out of circulation. We've been in contact with, DEA does these national take-back days twice annually, very expensive. And then because they incinerate the drugs, it's not eco-friendly to the environment. And one of the things that Deterra does, other than that other take-back drugs don't do, is that the package is made of sugarcane. Yeah, RX Leadership Initiative. Thank you very much, Tanya. So thanks for the assist, Tanya. And I'll remind Commissioner McCoy, remind me to give Tanya a coin when I see her next. Okay, these things are made of sugar cane, and so when you put the drugs in, add a little warm water, throw it in the garbage, it's biodegradable. And it begins because it's made of, the outside covering is made of, the inside coverings are made of, the insides are made of organic compounds, which absorb back into the earth. And the outer covering is made of sugarcane. And so it dissolves over time in landfills. And so we believe in it. There are all kinds of studies that have been done too, out of a pain clinic, orthopedic pain clinic in Minnesota, that they've learned from issuing Deterra with their patients that they were overprescribing pain medications. And so they've been able to kind of right size on pain medications. And so there are just a host of environmental friendly opportunities and recorded data and studies that really shows the efficacy and the effects of Deterra, positive effects of it.
Great, thank you, General Price. So climbing back up to 10,000 feet here, Dr. Cunningham, curious what your thoughts are on, what the Opioid Settlement Board will tackle first, and what your office is looking at as the biggest problems as far as approaching the epidemic over the summer.
Yeah, so I just want to say that in terms of also the successes that we heard, that in the past 2 years in New York State, that over 50,000 Deterra bags have been distributed, and we're planning to expand that tremendously. So right now we're purchasing 300,000 bags, so 6 times the amount that we did in the past, and really making tremendous efforts to make sure that those get into the hands of people who need it. And so some of the things that we're doing include like working with the State Office of Aging. Think about people who are older, polypharmacy, the number of pills that they have, and some people are not able to get out of their homes so easily, right? And so these kinds of partnerships to make sure that we're really targeting the populations who are most at risk, who have a lot of pills on hand, who might not be able to use other ways to safely reduce risk is an area that we're focusing on. In terms of the Opioid Settlement Board, obviously there's been a lot of talk about that. I know people are really excited about that. And it's going to be critical, this board, to really provide recommendations to the state about how to best allocate, funds that have been received through the opioid settlement cases. So we're planning on holding our first meeting in June. Those dates have been released. And so, we're really preparing, our board and ourselves to dive in. So in terms of some of the priority areas, we have spent a lot of time meeting with people in the field to identify some key priorities that we're going to be, expecting the board to consider. And so a lot of these you've already heard from, our elected officials. Really expanding evidence-based approaches is key. Medications is a huge part of that. We know that, medications reduce death by 50%. So it's really effective in treating opioid use disorder. And we know that, only 10 to 20% of people who have opioid use disorder are in treatment. So that's a huge area that we need to expand, and we need to expand this by bringing treatment to where people are. So through mobile methadone units, these are things we've already started funding, not necessarily from the opioid settlement dollars, but through other dollars. And again, harm reduction approach, bringing the medication and the treatment to people in the communities that need it. Overdose prevention, you heard Senator Harcum talk about this, expanding naloxone, so that we can reverse overdoses, working with our partner agencies, the Department of Health, to do that as well. Transportation is a big issue, right? Again, people in rural areas, so funding, supporting transportation so that people can get to the services that are available. And then in terms of thinking about, we also heard from Assemblymember Stack about making sure that there's warm handoffs. So from emergency rooms, from EMS. So this is something New York Matters does. We want to be able to expand that across the state as well. So that again, when people, need treatment, that it's available, and we can use telehealth. We can use all kinds of tools to be able to help them get connected. And then also thinking about, our prevention providers and our prevention resource centers, mini grants, to provide to them so that people in the local areas can also decide what the needs are locally. So we're going to be working, with counties. Counties are going to be developing plans and sharing them with us. And so that, to make sure that there's not one size that fits all, right? It depends on the local needs, and working with, the counties and our providers, regionally and locally to make sure that we're addressing their needs as well.
Excellent. Thank you for that. Assemblymember Clark, you're a leader statewide on this and locally in Rochester. Wanted to hear more about what you're hearing in your district and in Rochester and the Finger Lakes.
Sure. Again, I agree completely with the commissioner that this is sort of all ideas need to sort of be talked about, solutions and all the different treatment areas that we need, or the whether it's like Monroe County, you were just talking about naloxone, and our DOH is starting a pilot program that will put 50 boxes around Monroe County, because we are seeing overdoses more and more in public areas, and our bus station is one of them in our downtown area. I think there's been at least 2 or 3 where one of our very big activists in this world has gone there herself to administer it, but creating this public access to it in these boxes when needed, because it is happening in more and more public spaces, that we need to treat the overdose at the moment that it happens, when someone's in crisis, and try to save that life. And then obviously the steps that we need to do beyond that are multifaceted, but we are working on that. We are seeing one of the interesting things. We were just doing a tour of one of our highest opioid neighborhoods where people are really coming in. There's a lot of needles and a lot of different, we can see where there's a lot of usage happening, is that most of them don't live in the city. They come from the county and they come into the city. So what are we doing? Because this is really taking a toll on the neighborhoods themselves and the housing. But then I think what was really interesting with Assemblyman Steck was mentioning on the mental health piece, we can do all this that we want to on making sure that we're taking drugs out of the system, taking them out of our medicine cabinets, doing whatever we can on the not prescribing them as much and looking and all these different things. But we also now have a generation of children, my own included, that have been really affected through trauma, through COVID, through upticks in violence. And if we aren't really addressing the linkage between mental health and drug addiction, why do people initially take drugs to begin with? It's usually a form of self-medication for some other issue. What are we doing about that? And we really have a crisis with our youth right now around mental health, and that we really need to make sure that we're creating that intersection between the two so that we don't have another generation of increasing opioid use and opioid addiction. Education is the key. So I really look forward to seeing how we're going to use that, the opioid resettlement money and that board to push down into education to our kids, and really figuring out their mental health needs right now, making sure those get treated so that they're not looking for other forms.
Yeah, thanks for the talk. That was excellent. So County Executive McCoy, do you want to talk a little bit about what you're seeing on the local level in Albany as well?
Yeah, I do want to hash what the general said, and Assemblywoman just said. Look, this is about treatment, recovery, and prevention measures. But 26 months we've been in the COVID world. So you tell me, anyone on the Zoom call, how many drug drop-offs have we had in the last 26 months? None. And when I look at 2019 to 2021 in our county with a 77% higher rate, that's like the terror makes a difference because you don't have the drugs around. And Assemblywoman, you're correct. People have been home. We were shut down for 5 months. So, look, you get focused on the emergency in front of you, and sometimes you get the horse blinders and you forget about what else is going on. And something like the Terra, if it was more readily available, it's all the tools in the arsenal, because the more tools we have in the arsenal, we can prevent stuff like this. And when we're seeing on a local level, it goes back to, Doctor, I think you were just saying at Cunningham, we did an outreach a couple of years ago, and we go to our Hill Towns community, and it started as an experiment because we couldn't get people to come in. Transportation's always been an issue for people. I joke around saying they don't want the fresh air of the city. They just want to stay up where the air is not as good. But we go out there and we do senior services, probation, health checks, and we gotta do more, be more mobile and think outside the box. Because again, without a partnership, and we can't get this done. And I do want to say to the Senate Assembly, thank you so much for everything you're doing. And when you start this committee to really get the ideas from around the state of how this money could be used, and trying to focus and looking at it differently, because I always joke around, I go, there's an M and E in team, but there's no I, and we can't get this done. We can sit here as politicians going, I, but without a partnership and useful resources, we're never going to make a difference. And that's what I see on the ground level when we started doing the Narcan training a couple of years ago, and we started doing treatment and recovery stuff from around the county. That was making a difference, reaching out to people. And what scares me too is a lot of, and I'll throw this back on the Senate Assembly, not for now, but for a debate down the road, a lot of coroner's office don't truly keep good statistic numbers on overdoses. So what scares me, there's probably a lot more overdoses out there than we're aware of. I can tell you, I continue to always try to get that data out of mine. And it's like pulling teeth sometimes at a dentist's office. So where we can make a difference is talking to the people that need a treatment. And again, having friends that went through recovery, losing friends to suicide because of prescription drug killers. Sometimes that person has to hit that rock bottom in order for them to get there. But when you look at treatment and recovery, you got to extend the healthcare, because healthcare only gives them 3, 5 days, 10 days at max in treatment. These people need 30, 60, 90 days, sometimes longer. And if we're not changing the way the healthcare industry is, or the cohesiveness of how they operate, we're not going to make a difference. And if you look at, and I'll leave it on this, when you look at 4 out of 5 people, new heroin users start off with painkillers. And, it all goes back that whole circle. But again, that's, I do want to compliment the Assemblywoman and Dr. Cunningham and the General, because again, everything's useful, everything helps.
So I think that's a great segue into our sort of final set of questions here, which I'll pose to Senator Harkin and Assemblymember Stack. With session adjourning in just a matter of days, what do you see as the priorities for harm reduction and the opioid epidemic before the end of session?
I wanted to follow up on what County Executive McCoy said, and also Assemblymember Clark. There's a lot of talk about the mental health needs here, but honestly, not much is being done on that. The existing mental health system has a severe shortage of providers. There's a severe shortage of programs. In the Albany area, for example, there is basically one program available for this. And, otherwise you're talking about sending people out of the area, which isn't a bad thing because they need the help, but we need to expand the availability of mental health treatment. You can't have a situation where someone comes out of a drug treatment program with great success and then has a psychotic episode, gets sent to the mental health ward of a hospital, gets shot up with a whole bunch of antipsychotics, gets released 3 days later, is wandering around the city of Albany, gets taken to CDPC, and then you're all scrambling around trying to figure out what to do. So there has to be a more organized system. And, I don't think the solution is to try and use less qualified providers to deal with mental health issues. Mental health issues are not like diagnosing a broken arm. You need people with a lot of qualification and a lot of experience, and oftentimes just simply giving someone an antipsychotic isn't particularly getting to the heart of the issue. So I think we have a long way to go, not just in recognizing the need for mental health services, but the existing services that are available really need to be reevaluated.
Jim, first, I would say thanks for the invitation today. As far as what's coming and what we've done, actually the Senate tomorrow is going to be passing a major package of opioid-related bills, many of them dealing with copays, with qualification setting, with peer reimbursement, with requiring medication-assisted treatment at certain facilities. So we have taken a very aggressive and comprehensive approach in the Senate. And one of the things that we have focused on as well, we talk about mental health, which is a critical piece of this. And part of the problem is we have a siloed system. So we have OMH and we have OASIS, who does a terrific job. Thrilled to have the new commissioner here. But for providers and for families to navigate these two separate systems and bureaucracies is really, really challenging. And as was mentioned before, preponderance of patients presenting for substance use disorder also have co-occurring mental health disorders. So we need to find better ways to integrate care. In the Senate, the last 2 years, we've passed legislation for the merger of those two agencies so we would have a behavioral health agency, as many other states do, and as our counties do and our cities do. But if that's not the approach that some folks want to take, we'll continue to have those conversations. But we continue to very aggressively work in all four areas of harm reduction. First goal, let's keep folks alive, improving treatment capacity, breaking down barriers, improving supports and transportation and housing for recovery, and then on the prevention side as well.
Well, I just wanted to add that, the concept of the merger is some long-term thing, but we have to do something now. There are solutions available, and we just need to be bold enough to put them into effect. because we have people that are suffering, and redesigning the entire system would take a great deal of time. So we have passed a number of bills out of the Assembly committee that I chair on these issues. And, I think the mental health component, can't stress enough that we can address that now and get past the siloing, which Senator Harckham referred to.
I just want to jump into about the mental health issues. I mean, clearly this is a big topic. Everybody's interested in it. We know with COVID, mental health issues have risen to the front. We recognize this clearly. About 50% of people who enter OASIS certified programs have mental health issues. And, we do I work with the Commissioner Sullivan in in OMH to really think about how we can, address co-occurring disorders. And so some examples of things, new initiatives that are coming out include like the Crisis Stabilization Center. It's co-supported by OASIS and OMH for people to come in the door with a crisis. It's either a substance use crisis or a mental health crisis or both, and staffed in a way that can address both conditions. And so these are the kinds of initiatives we definitely recognize are important and needed. And, and moving forward, we're doing more and more to sort of co-sponsor these kinds of initiatives that can address both mental health and substance use issues.
I would mention that the Stabilization Centers are a 24-hour program. And as the county executive, I believe it was mentioned that the solution for a lot of these folks are long-term in nature. And we do have 14 treatment centers that are operated by the state of New York. And we'd like to see those centers do a more comprehensive effort with respect to the co-occurring disorders, at least in the short run, before we talk about redesigning the entire mental health and drug treatment system. I think that the OASIS system works extremely effectively for the folks that don't have the added mental health problems. But as Senator indicated, that's 50% of the folks at least. So it's very challenging indeed.
So thank you for that. That discussion was excellent and much appreciated. So I want to take a little time to make sure that we get to the Q&A. We have quite a few questions in the queue here. I'll try to get to as many as I can. The first one is for General Price. Can you talk a little bit about the prevention approaches you referenced before in a little more detail and how that stops the issue before it starts? And is there more that cities can do to focus on efforts on prevention, in addition, in parallel to treatment?
Yeah, so first of all, that our focus is to way upstream, abstinence almost, to solve the problem or to delay first use until after the brain is fully formed. And that's of any addictive substance, whether it be alcohol, tobacco, or drugs. And so that's what really we teach as an organization. We're doing tremendous work with kids beginning grade 6, age of 12 and above. And we teach them principles of prevention, and we disguise it as leadership training. And then what's amazing is that those kids go back into their communities as prevention specialists, and they empower others. And so that's kind of our motto: is each one reach ones. We empower individuals and send them back into their communities, and then they solve their own problems. The other piece that we've learned in our Prevention Coalition model is that after a year of training with CADCA, and you become certified prevention specialists or graduates of the National Coalition Academy, we really teach those communities and those sectors of those coalitions, 12 sectors in total, how to work together and work together collaboratively, not losing their identity as a sector, but bring in their attributes and their resources to the table to work collaboratively. And what we found is that although our focus is underage drinking, cessation of all use of tobacco products, and stopping use of illegal or illicit drugs, and stopping first use of those drugs until after the brain is fully formed. What we found is that you can overlay our model on any scourge in the community. And we have 5,000 coalitions that prove this for us, that you can overlay our model on any scourge in the community and they'll solve it, be it suicide, hazing, bullying, stigma. It works. The philosophy of teaching and instructing and helping them to work collaboratively is that you can utilize it in any scourge, and we've seen tremendous success. Some examples during COVID are, we have one coalition out in Washington State where there's a large amount of prisons in that locale. And so there's a lot of recidivism and folk going back to jail. They're teaching them life skills. Communities all over the country, we're teaching kids computer skills, and we're having laptop drives to help kids in underserved communities with who didn't have access to laptops. We did that. That's totally out of our wheelhouse. But again, it shows that once we teach them how to work together, they can certainly solve. And that's our focus and our motto, is to teach communities how to solve their own problems. We just arm them with the education and training to do that.
Thanks for that response, General. So we have time to get to a couple more. I'm going to try to get to two or three more here. So this next one, Dr. Cunningham, I think would be probably best suited for you. And it's how would at-home deactivation be integrated into existing Drug Take Back Act? And I guess I'd sort of add to that question, how is it already being integrated into Drug Take Back Act efforts?
Yeah, so we're working with, over 150 coalitions. We also have our 6 regional prevention resource centers. And so I think it's really thinking about what the needs are in the specific communities, right? And so some of these might, have included working with, for example, mom and pop pharmacies, right? So that there's education, working with them. There's the provision of the doTERRA bags as well. Some of this includes working with the State Office of Aging so that we can get the doTERRA bags into the hands of people who are older, right, and who are homebound. Some of this is working with hospice, for example, right? So again, we heard, General Price, your story about your brother and the number of pills at the end of life, which is very common, right? So working with hospice, targeting really where the needs are. So there's a lot of examples of how we're really able to expand the reach. And again, we're ordering 6 times the number of doTERRA bags, 300,000 bags. So really focusing on expanding this and then looking to see where the need is most and working with our local partners, our local coalitions to really figure out where is the need the most so that we can have the most impact in reducing our harm.
That's great, Dr. Cunningham. So the last question we're going to get to here, and you kind of touched on this, but the education efforts happening with pharmacies, have a specific question here mentioning that, they've tried to drop off old meds at numerous pharmacies that have refused to take their meds. And so I think the question is, how do pharmacies get educated on better, working through the Take Back Act and also, providing at-home deactivation?
I just want to say something about pharmacy. I think pharmacies are really so important in terms of thinking about the healthcare system. And frankly, I think we don't leverage pharmacists and their knowledge or the pharmacies well enough. And so this is an area that we're definitely focusing on. There are more pharmacies, right, than healthcare providers in a lot of rural areas, right? So people can have access to a pharmacy easier than they can have access to, specialized treatment. And so not just around prevention and deterrent bags, but all of, thinking about from treatment, right, recovery, prevention, harm reduction, how we can really, leverage pharmacies and pharmacists. I think it really prevents a huge opportunity. So it's the education, it's the deterrent bags, it's naloxone, making sure naloxone is stocked and available, right? Co-payments, issues around that and supporting the co-payments. It's making sure medication treatment like buprenorphine is also stocked and available. There's a lot of sort of myths around, distribution of buprenorphine or having a cap in pharmacies. This is something we're working on with federal agencies, all the way down to the local level in terms of the pharmacies, and thinking outside of the box. Right? What is the future for pharmacies in terms of any kind of medication? Can we do pilots, for example, on methadone treatment, right? We need to think out of the box. We are in the worst overdose, epidemic we've ever seen in this country. And unless we do things differently, we're not going to be able to address this problem. And so for us, really everything's on the table. We need to rethink what we're doing in all of the areas, right? Prevention, treatment, recovery, and harm reduction. And pharmacies, I believe, can be a key part of this. And so, we're working towards that now and, really sort of rethinking how we can do better.
Excellent. And County Executive McCoy, did you want to talk about a little bit about that?
No, I think it's all great points, and we really do got to think out the box because what we're doing is not working. And the more, like I said earlier, the more stuff we put in the toolbox to help us change the outcome, that's what it's about. And it starts with the little things of getting rid of the prescription drugs in your house, but maybe like doing a mobile app with, education, prescriptions that expire. Imagine that. You go buy a piece of, you buy a steak at the supermarket and it says expires on this date. You buy something that says it expires on that date. Well, you get prescription drugs and they don't say expired on them. One of the things we fought on a national level, stop giving 30 days when somebody gets hurt, give them 7 days, let them have to come back. And I know there's people, and I took criticism on this, that have chronic illnesses and they need prescriptions. And I understand that. I got educated from a lot of people on that. But again, alternatives to the painkillers. And when doctors, and think how many people, like Assemblymember Clark, I look at you and, having small kids, and when my kids are small, they get hurt. The first thing the doctor goes, here you go, here's some painkillers. And then, that starts that journey for them kids. And the general was correct. I remember when I went to Iraq and you went in to see the doc, and they're just giving you prescriptions after prescriptions. I'm like, look, I just got to, twisted something. It's the same thing. We have to stop. We're like one of, there's 300, like I said earlier, 331 million Americans in this country. But yet we have the most opiate use in the world. And if you look at India with 1.2 billion, China with over 1 billion, Russia over 1 billion. And yet, why are we using so many opiates? We have to think outside the box. But I do want to say thank you for letting me be part of this virtual conference we're having, and to the Assembly members, thank you so much. And the Doctor Review boards in general.
So that puts us just at about time. Would really like to thank everyone for joining us today. As you've heard, the multi-layered approach to this, almost as we saw throughout COVID, is absolutely essential. And the state needs as many tools in the toolkit as possible. So, to General Price, Dr. Cunningham, Assemblymember Clark, Senator Harcum, Assemblymember Steck, who unfortunately had to leave us a little early, and County Executive McCoy, thank you so much for joining us. I know this is an extremely busy time of year, and I know OASIS has a ton going on, the Senate has a ton going on. The Assembly members literally left conference to join us, I think. So really appreciate you guys making the time and for taking the time to discuss this important issue.
Thanks so much.
Thank you.
Thank you, Jim.